Hello, my friend, Dr. Paul Looney. I'm a psychiatrist, and that is my real name. I love being loony, and I want to share with you a few thoughts about potential approaches to depression with anxiety that might be useful for those of you who have a combination of anxiety and depression. I'm working with someone currently who has had a number of life events that have hit hard and now caused um, some serious anxiety along with some depressive symptoms and particularly insomnia. This particular person also has some obsessive tendencies when they get down, and so I'm going to be addressing that because it's a fairly common scenario. Whether the person uh, qualifies for a diagnosis of generalized anxiety or major depression is hard to assess when they're in the midst of turmoil and dealing with um, issues that have caused significant distress. The current diagnosis for someone like that would be an adjustment disorder with mixed emotional features or mixed anxiety and depression, or you could go with the insomnia diagnosis. That said, in terms of medication, and of course, as you know, I'm a big fan of other treatment approaches dealing with um, relational dysfunction, dealing with supplements, exercise, diet, those kinds of things. But in this video, I'm going to specifically address the potential benefit of medication. I tell people that when they're dealing with a lot of distress, currently, especially when there's insomnia, our main goal is to get their sleep back on track. A lot of times when you're sleeping well, your brain will start to heal. You'll feel more positive, less stressed, less anxious, and less depressed. So in terms of the insomnia, one of the approaches I try first is, of course, over-the-counter things like melatonin. We used to use Benadryl or diphenhydramine a lot, but it's been shown that anticholinergic medications like that can predispose to dementia, and so I avoid the diphenhydramine. Melatonin, for some people, is very useful. I myself like Sleep 3, which helps me get to sleep and stay asleep. So melatonin is something to try. If that doesn't get a good result, then I often will try an old antidepressant called trazodone. The brand name was Desero, but trazodone, Trazodone, comes in anywhere from 50 milligrams to 300 milligrams. And I typically start somebody at 50 or 100 and gradually titrate up if needed. The main problem that most people have with trazodone is that it can make them feel hungover or groggy the next day. But for those who are able to tolerate it and take it early enough in the evening so they don't have that hangover effect, it can be a fantastic solution for insomnia, especially if it's a chronic condition, because it's something that you could safely take every night for the duration. So trazodone is a really good option for that. If the trazodone doesn't work, or if the sleep is very disturbed and the insomnia is intractable, then you might go with a prescription medication. I really lean toward Lunesta. Um, the Azopiclone is the generic name. It comes in 1 milligram, 2 milligrams, and 3 milligrams, with 1 milligram usually being for geriatric patients or patients who have limited kidney function or just need a touch. Generally, I'll go with the 2 or 3 milligrams. If the insomnia is very significant, though, I usually go with the 3 milligrams. The nice thing about this medication, in comparison with other hypnotic medications, is that it appears to not interrupt the normal sleep architecture. We have several levels of sleep, and the fourth level is where we get our deepest sleep. REM sleep is a little less deep, but it's also very important. And some medications will diminish REM sleep, which can have its own problems. So the Azopiclone or Lunesta, either 2 or 3 milligrams, can be a really good option. If you've been on it for a while, then you will have a little rebound insomnia, but it's usually not as bad as the rebound you get with other agents. And so I think that's a really good one. There is a medicine that just lasts for 2 hours, and it's something that if the person is suffering early morning awakening, this medicine can be very useful. It's called Zaleplon, Zaleplon, and it comes in 5 or 10 milligrams. I usually use the 10 milligram dose, and it's very cool because it only lasts for a couple of hours, so it's very useful for early morning awakening. It's also great for travel if you need it for that. So those are sleep medicines: trazodone, Lunesta, or isoprolol, and Zaleplon. For the anxiety, if the sleep gets better, the anxiety should come down. But aside from supplements that I talk about in other videos and exercise, for medication, I really prefer buspirone if it's going to be for long-term use, because people have long-standing anxiety. It's probably not going to go away, and the buspirone can be very useful. It comes anywhere from 5 milligrams up to 30 milligrams. It's designed for 2 or 3 times a day. Most people can't deal with a midday dose, so I usually prescribe it twice a day, morning and evening. And my standard protocol is to prescribe the 15 milligram and have the patient start with a half of a pill morning and evening. If the half seems to be too much, those pills can be broken into thirds, so you could start with 5 milligrams twice a day. Most people tolerate 7.5, and in fact, after a week or so, most people can go to the full dose, 15 milligrams twice a day. I find that 30 milligrams a day is, generally speaking, a good dose, although some people need to go up to as much as 30 milligrams twice a day, a total of 60 milligrams. So buspirone is really a great agent, tends to have a very good side effect profile. If you do have side effects in the beginning, just back off on the dose and gradually ramp it back up to get the desired result. Just be aware, it doesn't take effect immediately. It dials down anxiety over time, so you have to be patient. You won't get the full result until you've been at a therapeutic dose for about 2 months. But other than that, it's a great agent. So the most commonly prescribed medications for anxiety, for panic, and for depression are the SSRIs or the SNRIs. SSRI, as most of you know, stands for serotonin-specific reuptake inhibitors, and in fact, they are very useful for depression and anxiety. That said, there are some problems. Both the SSRIs and the SNRIs, which stands for serotonin norepinephrine reuptake inhibitors, because it works on both serotonin and norepinephrine receptors, they tend to have some tendency to cause weight gain. They tend to cause some sexual dysfunction. They tend to cause some emotional blunting, and they're hard to get off of. They tend to have a withdrawal syndrome if you stay on them very long. If you just need them short term, then they can be very useful. And to be fair, for some people, they're a good option for longer term anxiety and depression as well. But for the reasons I just listed, I tend to stay away from them. If, however, the person does have a lot of obsessional or compulsive tendencies when they're depressed or when they're not, then Prozac is my agent of choice because it seems to be very useful in diminishing obsessive thoughts and compulsive behaviors. People who have an OCD look to their syndrome when they're depressed often do well with Prozac because, again, it reduces those obsessive loops that people can get in. And so for that reason, I like it. I think I've said in another video that for whatever reason, the brand name Prozac is far superior to the generic, but it's insanely expensive in the United States. So you can order it. You can go to pharmacychecker.com and find a pharmacy out of the country that has the brand name Eli Lilly Prozac for maybe only 60 or 80 cents a pill. While I'm thinking about it, though, any of you who are needing or are concerned about having psychiatric medications on your pharmacy profile or your medical profile, you can always order medicines from out of the country so that the information doesn't use against you in hiring or job market or getting health insurance or life insurance. Generally, when some of these agents are seen, the life insurance company or the health company may assume that you're dealing with major depression recurrent and that they're at risk for you attempting suicide, which for the majority of people is not an issue. If it is, then your insurance company probably needs to know that. Um, in addition to the SSRIs, SNRIs, there are some other agents that can be very effective for depression and anxiety, or those symptoms that show up in times of stress. One that I've devoted a whole video to is lamotrigine, which does have a calming effect on the brain. It was originally designed as an anti-seizure agent, but was soon found to have antidepressant and calming effects. So it's another one that has a really good side effect profile, but as you'll know if you watch the other video, in rare cases it can cause a skin rash that if left untreated and if you don't stop the medicine, it can proceed to a rash that can be disfiguring and even life-threatening. So very important to start at a tiny dose and gradually build up to avoid the risk. Once you've been on the medicine for a couple of months, then the risk is virtually non-existent. You're not likely to get the rash once you've been on it that long. In addition, there's another medicine that really deserves some airplay, and that is Wellbutrin or bupropion. It comes in several forms, but the XL is the one that I use because it's once a day dosing, which I vastly prefer to the other formulations. It comes in at 150, 300, and 450, 300 being the normal dose. However, it has great usefulness in dealing with people whose depression or anxiety has them low motivation, low mood, low energy, low concentration and focus, because it tends to be activating. Rather than working on serotonin, it works more on dopamine and norepinephrine, we believe. And so it tends to make people more alert, more active, more positive in outlook, while also for some people having a very calming effect. Some people, though, tell me that it makes them feel kind of wired, kind of tense. And if you're one of those people, then of course you're going to ditch the medicine. Good news about bupropion or Wellbutrin, though, is it's easy to stop. You're not going to have the withdrawal effects that you have with the SSRIs and SNRIs. So that said, Wellbutrin, along with say, Prozac with Wellbutrin, can be a great combination because it provides sort of a support to your central nervous system that addresses the problem from two different directions and can help calm your brain down while lifting your mood at the same time. And the sleep medicine, the SSRI, the bupropion can all be taken in conjunction. And if you do decide you want to try the lamotrigine, you can start one of the other agents first to give some relief until the lamotrigine kicks in. And Wellbutrin is one that tends to give a result faster than most of the others. Within a week or so, sometimes even with the first dose, people feel a little bit more hopeful, a little bit more energetic. And so it's nice in that regard because it does kick in more quickly. So these are just some of the thoughts I have. I tend to go toward older medications that are available in generic, partly because of the cost and partly because I just have much more experience utilizing them. I'm, nearing the end of my career, and so I don't keep up with all of the new agents as much as some of your providers do. So be sure and check in with them about newer agents that they may feel offer advantages to these older agents that I've been talking about. Hope that you have a really good day, whatever's going on in your world, that you get the help that you need. Pray that God will bless you with sleep, with a restful spirit, and with hope for the future. I love you.